you go down and then you go up to make it better, make it better. Down on the ground, it's just one way up. Make it better, make it better. If you stand by me, I will stand by you. To make it better, make it better.
Hello and welcome to Rise Up with Rebecca Seawright. I'm your host, Assemblymember Rebecca Seawright, serving the Upper East Side, Yorkville, and Roosevelt Island. Today's show features a very important topic. Every day in America, more than 10,000 people approach retirement, and the numbers are growing rapidly. By the year 2030, 1 in every 5 Americans are expected to be 65 or older. Many Americans who approach the age of 65 often have a lot of questions about Medicare, which is the federal health insurance program. People find it complicated and confusing to navigate and often have a lot of questions as they approach retirement. In fact, the staff in my office regularly get questions about Medicare from our wonderful constituents. So today we are thrilled to welcome Ari Parker, the lead Medicare advisor in Chapter, a tech-driven Medicare firm that advises thousands of Americans around the globe who are navigating Medicare. Ari is a Stanford-trained attorney who leads a team of licensed advisors at Chapter, and they have thousands of questions from people who are approaching retirement about Medicare. Ari is also writing an upcoming book, and we welcome him to the show today. Welcome, Ari.
Thank you so much for having me, Assemblymember Seawright.
And to kick it off, Ari, just give us a description of Chapter, how long you've been with the organization. I understand that you were one of the co-founders when you co-founded it, and what your mission is.
We started Chapter just before the pandemic started. It was February 2020, and I actually was my wife, she wasn't my wife yet, was in Tucson, Arizona, and she was wondering where she would work next because she's an astrophysicist and she was in her last year of grad school. And so my co-founders, Kobe and Corey, had already left their jobs and they wanted to do something related to healthcare because they had all this healthcare experience, Kobe on the tech side and Corey on the healthcare management side from his consulting days. And so they knew they wanted to do something healthcare related, and also that 11,000 seniors were turning 65 every day. And Kobe's parents were trying to navigate Medicare because they were coming up on Medicare eligibility, they were turning 65, and it was time for them to sign up for coverage. And so that's really the origin of Chapter. And then we decided to join together and to actually go about figuring out, how do you sign up for Medicare and what's the process?
And when does a person become eligible for Medicare?
There are 3 ways a person becomes eligible. The first and most common way is by turning 65. This is called the initial enrollment period. The second way is past the age of 65 and coming off large group work provided coverage. That means 20 employees or more. And then the final way is either by disability, or perhaps they have a rare condition like Lou Gehrig's disease or end-stage renal failure, or they missed their initial or special window, in which case they will use the general enrollment period.
Now, I assume people shouldn't wait until they turn 65 or meet one of these other 2 categories before they start researching what's available on Medicare. So advise us on when should people really dive in and start doing their research?
The earlier, the better. The early bird gets the worm. But even if you're turning 65 this month, it's not too late because your initial enrollment period actually begins 3 months before you turn 65 and extends 3 months after the month in which you turn 65. So the best time to start is really when you turn 64, if not earlier. And the government does have some resources here. They will send you a Medicare and You handbook. It's 125 pages long, and it's quite dense. It actually looks like a law school horn book. It reminds me of one quite a bit. And that's where I thought there's actually a better way to explain this information. And I wrote a 45-page book called It's Not That Complicated that breaks down the 3 key Medicare decisions someone who's approaching Medicare eligibility will think about.
Now, how does Medicare compare to private employer issued Medicare?
Well, in some ways, it's quite similar, and in other ways, it's very different. It depends on the type of plan that you choose. Let me take a step back, though. The first question is, when is the best time to enroll in Medicare? After you enroll in Medicare, though, it only covers 80% of your medical costs. So the question becomes what to do about the other 20%. Here, there are traditionally 2 types of plans that someone can choose. They can either choose Medigap, which covers the other 20% and retains the flexibility of original Medicare, allowing you to see any provider who accepts Medicare, and 93% do nationwide. The second type of coverage is a Medicare Advantage plan. And we see William Shatner talking about this, especially in the fall. There's a lot of commercials for Advantage plans. And this is the type of coverage that will feel familiar to someone who's leaving their employer. This is an all-in-one type plan that comes with additional benefits like prescriptions, because original Medicare doesn't cover prescriptions. It was only added in 2006. And dental, vision, hearing, and sometimes even grocery or transportation benefits. So that's what will look most familiar to employer-provided coverage. Now, which type of coverage will be right for one of your constituents is probably what they're wondering. You just explained 2 different types of coverage. What should I choose? And so this is where it's really helpful to search across all plans that are available in your constituent zip code. It makes a big difference whether you live on the Upper East Side or whether you live in Queens. It makes a world of difference. In fact, the plan offerings are completely different based on the county in which you live in.
And so it's all based on the county in which you live in.
Yeah, one caveat here, which is that New York is a pretty exceptional state in its Medigap protections. It actually offers guaranteed issue for Medigap to all New York Medicare eligible residents, which is really significant because that's only true in one other state. That type of protection is only true in Connecticut. So it's New York and Connecticut that have exceptional Medigap protections here.
And are there any common mistakes that people make when they enroll in Medicare the first time? And are there ways to correct these common mistakes that occur?
There are some mistakes that are correctable and others which aren't. So I know that you spoke to Kobe recently. Kobe's my fellow co-founder, and he emphasized that there are late enrollment penalties, and these late enrollment penalties are lifetime and they're cumulative. So they keep adding up the longer that you wait to enroll. If you've waited too long to sign up for Medicare and you decide that you need to sign up now, you will owe a late enrollment period unless you had coverage at least as good as what Medicare offered. And that's true of both Part B, which covers outpatient services, and Part D, which is the prescription benefit. Now, what if you enroll in Medicare by way of turning 65 and then you get a job? This happens all the time. In that case, because you properly signed up for Medicare on time, you can actually disenroll from Medicare Part B. And Medicare Part B has a premium attached to it. For most Americans, it's $170.10. So instead, they might say, my employer is offering coverage. It's 20 employees or more, and it's $25 a paycheck, $50 a month. Great. In that case, a member of my team would send a form. It's called Form 1763, and it allows you to disenroll from Medicare Part B. And then when you leave your work provided coverage, you'll actually get a special enrollment period to re-enroll in Part B.
So what are some important questions that people should consider if a person is not retired at 65 and they're still very much in their career and have no intentions of retiring anytime soon? How can they judge whether to stay on their work-related insurance plan or switch to Medicare?
This is a fantastic question. It's probably one of the most frequently asked questions that we get.
Mhm.
And we built a tool here to help people decide, because it's a complicated problem with actually several inputs. The first is, how do you like your work coverage? Is it a high deductible plan? Many have become high deductible, in which case it's essentially catastrophic coverage. The deductible ranges from $6,000 to $10,000, which is the amount that you owe before your coverage kicks in. The deductible with Medicare is exceptionally low. For Part B, it's $233 per year for this year, for 2022. So if you weigh the multi-thousand deductible on a work provided coverage versus the $233 deductible for Part B, many people will say, well, Medicare is a better value. The second thing is, how much are you paying for that coverage? Because typically this is a deduction from one's paycheck, and then you have to multiply that amount by how many times you get paid. So if you pay $125 per paycheck, if you contribute that amount towards your health insurance, you're actually paying $250 per month. And many people lose sight of that, because the price for Medicare Part B for most Americans is $170.10 for this year. The next question is how your work coverage, how the network of doctors that your work coverage allows you to see are the doctors that you want to see in network. Another question is, how's your health? If you need to use a lot of care, then it might be a better value to start Medicare. And then finally, the additional benefits. The prescriptions that you take, the pharmacy that you use matters. It really affects pricing. And those are all factors to consider when evaluating whether to stay on work provided coverage or make the transition to Medicare. There's one more thing here, which is that if you work for a small group employer, which is 19 employees or fewer, then you actually don't have a choice here. You need to start Medicare Part B. You must enroll in Medicare Part B.
The key here is under 19 employees. Now, you mentioned a tool that your firm has created. Is that a checklist? Is that something that that you mail out to people, or that you have on a website, or what exactly is that tool that you referred to?
It's a calculator on our website that you can actually access. Our website is askchapter.org, askchapter.org, and you can find it right there on the header.
And many of our senior citizens, they're not comfortable with their computers, and they've stopped doing email, and we get numerous calls and referrals of different community-based organizations that help our seniors with their emails. So if they're having trouble, how would they access your website and the calculator?
Best way is to call. Most of our clients call. And our number is really easy. The number is 855-900-CHAP. 855-900-CHAP.
Great. And what are some of the misconceptions about Medicare?
There are several misconceptions. The first is that you can enroll anytime. We know at this point it's not true. If you work for a large group employer, meaning 20 employees or more, then you'll have a special enrollment period to sign up for Medicare when you choose to retire. But it's really important to act within that window. Otherwise, you'll have a gap in coverage, or you'll even miss your window and thereby owe a late enrollment penalty. The second misconception about Medicare is that it's free. A portion of Medicare is free if you've paid 10 years of federal payroll taxes, but Medicare Part B is not free for most Americans. In fact, it costs $170.10. And if you earn more than $91,000 and file individually, or more than $182,000 and file jointly, then you'll owe more than that $170 figure. So those are two misconceptions. One, that you can sign up anytime. Two, that it's free. It's not free. And then three is that it covers everything. It doesn't. It only covers 80% of your medical expenses. So that's where an independent advisory like Chapter can really help, because they can go through how to cover the other 20%.
Right. And I love the name Chapter. Tell us how you came up with the name for this organization.
The name Chapter comes from the way in which we move about our lives. So we start typically with our first chapter, which is going to school and reading and learning. And then our second chapter, which is perhaps meeting our significant other, starting a family, starting our careers, going to school, making new connections. And then, of course, we enter our working years. And the question is, well, how to spend the remaining chapters? And that is the way in which we think about it. How are we going to maximize the chapters that we have? What's your next chapter? And this is something that we talk to our clients with, that we dialogue with our members about. We really enjoy asking what they're up to. Lots of clients right now are traveling, and it's really fantastic to find out what they're planning to do after they're done working.
Great. And is there a fee to work with Chapter?
No fee. We are 100% free to our members. Now, you're probably wondering, well, how do you get paid? And the answer is that some insurance carriers do pay us a commission, and it doesn't affect our recommendation at all, because in our database, we search through all 24,000 plans nationwide, and our advisors actually get compensated based on whether they make the best fitting recommendation for the client, not based on whether it's a plan that Chapter is appointed with.
Great, that's terrific. And what's the number one most important question that you get asked by people that reach out to Chapter?
The biggest question is where to begin. It is an overwhelming amount of information to take in. And there's this idea that it's a very complicated process, and that you essentially have to wave a magic wand and know somebody in the Social Security Administration, but actually you don't. And I've seen this process work from my mom, from my aunt, from my grandmother, from my wife's grandmother. We've really seen that Medicare works, and that if you follow the rules and you have some expectations set going into the process, that you can actually get quite far in a very short amount of time. So even if you've waited until the deadline, let's say you're turning 65 tomorrow, it's not too late. Now is the time to get started. And to help, feel free to email me, to reach out, ari@getchapter.com, and I'll actually send you a pre-release edition of my book to help you get started.
Terrific. And what is the name of your book?
It's not that complicated. That's the name of the book.
Great. Well, I think your organization does a terrific job in simplifying this plan. And if you could repeat for us again your website, your phone number, and how people can reach out to you.
Absolutely. Our website is askchapter.org. Phone number is 855-900-CHAP, 855-900-CHAP. And you can reach me directly by email, Ari, A-R-I, @getchapter.com.
And how long does it usually take once a person has reached out to your organization to get a response? Is there a waiting list?
Same day, unless it's Sunday. We're closed on Sunday.
Terrific, terrific. And is there a waiting list once a person signs up with Chapter to get their questions answered? Or you said that generally speaking, the same day they get an answer back. Is there certain times in the year when there is a waiting list?
Busiest time of year is the fall, because that's the annual enrollment period, when people, if they're on an Advantage plan or a prescription drug plan, can change their coverage. So the fall is busy. If you have questions about starting Medicare, now is a great time. August is especially a good time. But again, we really do strive for 24-hour turnaround.
And can people enroll at age 62 if they retire from their job and decide to opt in for their Social Security? Can they get Medicare at age 62?
No, unless they're qualifying by way of disability. If they are qualifying by way of disability, then they would receive Medicare in the 25th month in which they're taking disability benefits. You must be 65 typically to start Medicare.
And does your Chapter organization also help people with disabilities that are turning 62 and taking disability? Or do you also specialize in that as well?
Absolutely.
Terrific. Well, recently we were in special session in Albany, and we passed the Equality Amendment, which include disability rights. And so I'm very pleased to hear that you're also working with our disabled community on helping as well. And
Yes, and I see you're wearing green, right, in support.
Yes, yes. Well, Ari, I think this is wonderful. And like I said, we filled questions from our constituents, and we want to encourage them to reach out to our office at 212-288-4607. And we're happy to answer questions and refer you to chapter. And we appreciate your joining our show today.
Thank you so much for having me on your show.
Thank you. And we look forward to having our next speaker on our next series, addressing the monkeypox and what we expect with COVID coming up in the fall with the surge. So thank you for tuning in today, and have a great day.
First you go down.